as you've just heard, we just kicked off what is the 52nd session of the CPD, the Commission on Population and Development. We were delighted to hear a really sort of stirring keynote address by the activist, humanitarian, and actress Ashley Judd, who really inspired us this morning. This is a landmark year, 52nd session, because this is 25 years since the seminal ICPD was adopted in 1994. And so it's a chance for us to reflect on what has been accomplished in the intervening 25 years. And there have been notable successes, although some stubborn challenges persist. With respect to the successes between 1994 and today, the under 5 mortality rate globally has fallen from 89 deaths per 1,000 live births, which it was in 1994, to 41 in 2019, which is a reduction of more than half. So I think that's a signal achievement. And I would also cite the fact that in the last quarter century, life expectancy at birth has risen from 65 years to 72 years. This is globally for the world as a whole, while the gap in life expectancy between countries in the more developed regions and the least developed countries, that gap there between developed and least developed has narrowed by 7 years. By 7 years. Let me of course, these are averages. The situation looks different in different parts of the world. Regions with life expectancy above the global average of 72 years include, and you probably can guess this, North America, where the age is 80, Europe, the age is 78, and my own region of Latin America and the Caribbean, which is 76. Now, there are some regions that are below the average in terms of life expectancy. Central and South Asia, 70. Oceania, excluding Australia and New Zealand, 68 years. And Sub-Saharan Africa, where life expectancy today is only 61 years. Since 1994, the total fertility rate has fallen from 2.9 to 2.5 births per woman. And today, over half of the world's population live in countries with fertility under 2.1 births per woman. At the same time, the availability and use of modern forms of contraception have markedly increased. Regions where the level of total fertility remains above the global average of 2.5 include Sub-Saharan Africa, and this is a staggering number really when you look at the disparity. They are at 4.8. Oceania, excluding Australia and New Zealand, 3.4, and Western Asia and Northern Africa, 2.9. So although we have made much progress, our achievements have fallen short on many of the targets that we set for ourselves 25 years ago. And when I say falling short on many of the targets, I'm talking about targets on poverty, child marriage, urban slums, and also the percentage of affected persons in some instances are declining. The absolute numbers are growing. So this is cause for concern. The good news from this morning is that members of the CPD, as we call it, understand this and they acknowledge what is at stake and what needs to be done. Just minutes ago, I was able to gavel a political declaration in which member states commit themselves to accelerate the full and effective implementation of the program of action. Now, this is significant that we have actually adopted something, because in 3 of the past 4 years, we have been unable as a commission to come to a consensus on an outcome document. And so this, I think, is a landmark achievement as well, which really has to do with the significance of having something that can effectively and do just to acknowledge the 25-year commemoration. The declaration also stresses the critical importance of this ongoing work for achieving the SDGs. When we were going through the informal consultations, that was one of the points that many member states said. 25 years ago, we didn't have a thought about the SDGs, but now that we have them since 2015, member states wanted to know that the political declaration that we were negotiating spoke about the alignment and the significance of the alignment between what we're doing today in terms of implementing Agenda 2030 and what we did 25 years ago. So now, what is before us in terms of population? As you probably know, we need to plan for a world of around 8.5 billion people by 2030. That population will not only be more numerous, but older and more mobile and more urbanized than ever before. And I think, when I talk about some of the disparities, some countries, the population is aging dramatically and the birth rates are declining. I'm thinking of countries like Korea and Japan, and this presents particular problems for them. And not just with respect to structurally how they're set up in terms of their norms, but also in terms of the solvency of their social security systems. Less people are coming into their workforce and they have more people to support in terms of their aged populations. So that's a particular challenge for them. By adopting this declaration, we as member states are demonstrating our commitment to address these and other types of demographic challenges as we proceed through to the 21st century. So with that, I'll end it there and just hand it over to the Executive Director of UNFPA, Dr. Kanem.
Thank you so much, Ambassador Courtenay Rattray, and we would like to thank you and congratulate you for your skill in bringing the declaration to consensus this morning during the 52nd session of the Commission on Population and Development. Today's success is a multilateral success story, with miles yet to go till 2030 to be true. However, we cannot overemphasize the significance of what we witnessed this morning, the adoption by this Commission of a landmark political declaration for the first time in its history. The declaration reaffirms the 1994 Program of Action of the International Conference on Population and Development in Cairo, and the Commission today called for accelerated implementation, so essential for achieving the Sustainable Development Goals of that 2030 agenda, as well as other achievements called for by internationally agreed development instruments. The declaration today reaffirms the Cairo Program of Action as a whole. It welcomes the progress made since Cairo, acknowledges the challenges that remain, and pledges further action and resources for full implementation in a clear demonstration that the world is united behind the goal of empowering women and girls and supporting their rights and choices, including women and girls' right to reproductive health, just as it was said 25 years ago in Cairo. And we do have things to celebrate, some of which have been mentioned already. Extraordinary progress since 1994, with a decline in the maternal death rate by around 40%. Rates of child marriage declined. FGM rates have fallen. Primary school accessible to most children in the world, and an increase in human life expectancy by 7 years since 1994, thanks in great part to leadership and to national strategies. And thanks in great part for the united efforts of a United Nations in action, through governments working with civil society and working with communities on the ground. So at this moment, we would like to inform you that this November, world leaders will again have the opportunity to seize the moment to mobilize needed resources and political support at the Nairobi Summit on ICPD at 25 years, Accelerating the Promise, co-convened by the governments of Kenya and Denmark in Nairobi from the 12th to the 14th of November. Governments, private sector, civil society, and community partners will get together to advance the implementation of the ICPD Program of Action as a foundation for the realization of the SDGs. Women and girls were placed at the heart of development in Cairo 25 years ago. We continue to reiterate that this watershed moment for sexual and reproductive health and rights, and today's declaration, which is a reaffirmation of these rights. Data serves people. Population is about people, not simply numbers. And population data helps us end the invisibility of those who would otherwise be left behind, including minorities, people who are disabled, etc. In Nairobi, we will have that moment when the world can stand up and ensure that universal rights and choices are indeed fulfilled for all. Thank you.
Thank you very much. John?
Thank you, Stefan. Good afternoon. The Population Division of the UN Department of Economic and Social Affairs is the secretariat for the Commission on Population and Development. But we do this in very close collaboration with our partner organization, UNFPA. Ambassador Rattray mentioned that the world's population in future decades will be larger, older, more urban, and more mobile. Let me quickly illustrate these four megatrends. Projections from the Population Division of DESA indicate that the world's population will continue to grow over the next several decades, reaching around 8.5 billion people in 2030, close to 10 million people at mid-century, and then ultimately reaching a maximum value and topping out and leveling off at roughly 11 billion people toward the end of the current century. Much of this increase is inevitable, given the large numbers of children and youth in the world today who will eventually begin to have children of their own. This is what we call population momentum. As growth slows down, however, populations also grow older, with an increasing share of older persons. By 2050, the proportion of the population aged 65 or older is projected to reach 28%, more than a quarter, in Europe, 23% in Northern America, 20% in Latin America and the Caribbean, 18% in Asia, much higher in some parts of Asia, and as much as 9% in Africa. All regions of the world are experiencing this process of population aging as they go through the demographic transition. And this upward shift in the age distribution of the human population has major consequences for society, especially for relations between generations. The global trend toward urbanization is another very significant trend. Today, we estimate that 56% of the world's population resides in urban areas, and that share is projected to increase to around 68% in 2050. Roughly, if you want to remember this, the urban share of the global population has gone from roughly 1/3 in 1950 to approximately 2/3 in 2050, over the space of 100 years, going from 1/3 urban to 2/3 urban. About 90%, as we look forward at the growth of urban populations, about 90% of the growth in urban populations between now and 2050 will take place in Africa and Asia. It goes without saying that building sustainable cities is critical for achieving sustainable development. Lastly, the world is becoming more mobile. Between 2000 and 2017, we estimate that the number of persons living outside their country of birth increased by almost 50%, reaching 258 million people in 2017. In countries and regions with low levels of fertility, international migration has become a major component of population change. In sum, population trends continue to shape our world, and these changes will have major consequences for achieving the Sustainable Development Goals and targets. I'm very pleased for this reason that the political declaration just adopted by the Commission has highlighted the important links between implementing the program of action from the Cairo Conference in 1994 and achieving the Sustainable Development Goals by 2030. I wish to congratulate the members of the Commission on Population and Development on the adoption of this declaration. I would also like to thank Ambassador Rattray and other members of the Commission's Bureau for their very hard work and devotion to this work and to the Commission session this year, and to congratulate them for achieving a very successful result. And last but not least, I'd like to take this occasion to convey my thanks to Dr. Natalia Kanem and the United Nations Population Fund for many years of excellent collaboration, and to congratulate UNFPA on its 50th anniversary.
Thank you very much. Yes, Nabil. And then, so I'm sorry. Go ahead, Evelyn.
Yes,
Go ahead.
Evelyn Leopold, welcome on behalf of the UN Correspondents Association. I see that you approved, you didn't go backwards from the Cairo conference. CSW had a bit more problems on that. You didn't get interference by the did you get interference by the United States wanting the global gag rule imposed? And I see that on your statistics, you have the question of contraceptive in Africa is only 25% usage. Is the United States blocking more of it, or what can be done to improve that? And also, if I may have one more question, the answer to the aging population you implied is refugees, is that, and migrants, is that correct?
Thank you. I'm happy to start, and I'll defer on some of this to the chair in terms of the actual deliberations. Speaking for UNFPA, we greatly regret the withdrawal of funding for life-saving sexual and reproductive health services by the United States and other member states who have adhered to the so-called global gag rule. It's very important to understand that when we speak of comprehensive sexual universal access to sexual and reproductive health, and also to comprehensive sex education for young people to be able to understand the life cycle and the human relationships, which may lead you to procreate or may lead you to decide to delay pregnancy, that the inhibition of funding for really vital services, including in humanitarian settings, has hampered our ability to deliver quality services in the locations and in the areas where women vitally need them most. From the perspective of bringing contraception to the 214 million women in developing countries who are waiting for the promise of Cairo to be fulfilled, UNFPA, acting in concert with numerous partners, including under the banner of Family Planning 2020, has understood that in a place like Niger, for example, which has the highest total fertility rate in the world at the moment, 7.1 children on average per woman, this is not necessarily by the woman's choice. And we come back to the issue of rights and choices because the availability and the affordability of modern methods of contraception of her choice have been endorsed by that government, by religious leaders, by the husbands' schools, where traditional chiefs have said, we wish for women to survive pregnancy and childbirth. So the lack of availability and the lack of funding to deliver is a huge challenge for UNFPA and for the partners on whom we depend to deliver such care. And I'm talking about a midwife in a refugee camp. I'm talking about a peer counselor who is truly engaging with a woman over her needs and desires. So, yes, it is lamentable that because of political polarization at this moment, the withdrawal of such funding really has had an effect on our ability to deliver. It does affect women's ability to survive and to thrive. And just briefly on the issue of aging and migration. UNFPA just in January opened our first office focusing on aging. It's based in Seoul. As you heard from my colleague, Korea and other parts of Asia are facing, shall we say, an aging boom. And our interpretation is that a second demographic dividend, normally we talk about the baby boomers and young people as a source of economic and social fulfillment. Well, older people can create a second demographic dividend, partly because active, healthy, older people who live in dignity and have the ability to have social support, whether it's pensions or disability that can track with aging. But they also have a very important role as part of the family in the cycle of life. So by protecting older people, we see we're protecting societies as a whole. And the mobility, the free, structured, orderly mobility of people is, in many places, a boon as the hollowing out of the working population occurs. It's very important for migrants to be able to exceed, to be able to contribute. And as a migrant myself, I can say that it is a very positive thing if we prepare adequately. We still come back to the adolescent girl being at the heart of the issue. If she is well prepared, if she survives during pregnancy and childbirth at a time of her choosing, if she is well educated, this transforms her life, the life of her family, the life of her community. Thank you for the question.
Thank you. Ambassador?
Yeah, just a quick response to that. Part of your question, I think, was a process question with respect to whatever pushback we may have received. I really have to tell you that going through the consultations, I was heartened by the level of constructive engagement from all member states. We only had 2 informals, but prior to the 2 informals, I met with each of the regional groups, not to go into the substance, but really to solicit their support with respect to a new way of working. We have no tradition in the Commission of doing a political declaration. We are breaking new ground here, and some member states are understandably always concerned to ensure that there's a legislative mandate for whatever it is that we're doing. We are a functional commission of the ECOSOC, and there is precedent in the ECOSOC functional commissions. The Commission on Social Development and the CSW have utilized this as a mechanical device to mark significant years. So CSW has had 3 political declarations marking 2010, 25, 2010, and 2015 as landmark years for them. And we very much based this draft on that format. So what I needed to do, we as a bureau, was to get the buy-in, because normally we would be negotiating throughout the entire week, negotiating on a resolution, not a political declaration, a resolution on the special theme. And what we're doing now, what we did was to negotiate, well, I don't know how much it will come out to when I see the official document, but we negotiated a 1-pager. And of course, you have some member states that are saying, wow, 1 page, it's not getting everything in there. The level of ambition is low. But at the end of the day, all of them were practical about it. We have serious problems that bedeviled the process in 3 of the past 4 years. And these are some of the sensitive issues that, the usual suspects that come up in the 3rd committee: CSC, childhood sexuality education, sexual and reproductive health and rights, gender identity. None of those things have gone away. And if we had tried this year to go through a negotiation of a resolution, we would have faltered at the same, this is my belief, we'd have run into the same problems because the landscape has not changed. So what we needed to do was really to get their buy-in, first of all, and we went through all 5 regional groups and we got the support pledged by all of them. So by the time we came now to the informal consultations of the whole, everybody agreed that, listen, stick to the basics, stick to the links to the Agenda 2030, emphasize the program of action and the significance of it, emphasize certain cross-cutting issues, and then be done with it. And I think people understood that if we failed, it would have gone struck at the very heart of the credibility, not just of our commission, but of the ECOSOC as a whole. And so You heard a lot of clapping when it was gavelled through, almost euphoric in nature, because people understood not just the significance of this moment, but that this was critically important to the credibility of the CSW and CPD and the ECOSOC going forward.
Thank you. Nabil, and then Edie.
Yeah, actually, my question is about what you mentioned, sir, about the urban population. It's 2/3 of population in the world now. So I can think of maybe the Middle East, like how significant is the role of the cities as political entities or political unit or political community. How important do you think, or is this something you can predict based on your data and information, that the cities can be the answer maybe for major challenges in a place like the Middle East? I can think of maybe Dubai. Dubai is a maybe good example. Saudi Arabia is planning also for a major city or mega city on the Red Sea. Egypt is building a new capital, etc. So, can you predict, or can you see where this trend is going in the near future? Thank you.
Yes, you asked me to speak about some things that, of course, are unknown about what the future will bring, but the numbers currently are just 56% of the world's population is living in urban areas, and that will increase to around 2/3 in 2050. So slightly different than what you cited. But you mentioned the significance of cities as political units, but I would also mention their significance as economic and social centers, and that sustainable development really depends on building cities that are well designed and which concentrate human activity in those areas. It's the way to minimize the total ecological footprint of the human population on this planet, is to have people living in cities which can be much more efficient in terms of the resources that are required in order to sustain a population. They can also be much more efficient as a way to provide services to the population. So there are many advantages to cities when they're well constructed, when they're well designed, when there's good planning. And I think this was misunderstood even at the time of Cairo. I must confess, this is one area of the Cairo Program of Action that I think is not really up to date. And kind of our understanding has evolved since that time of the importance of cities, and we shouldn't push against cities. Cities are really the way of the future and the way to have such a large population living on this planet. It's really the only solution. If I could also address one question that was raised by the previous journalist, this issue of replacement migration and are refugees or international migrants the solution to population aging? The Population Division published a report on this back in 2001. You may recall, or maybe you're referring to that, and I just believe that there has been some misunderstanding about this report and about its conclusions, and it's become part of a narrative of replacement and the great replacement that has been used by some people with very bad intentions. And I want to emphasize that the report that was published by the Population Division back in 2001 asked a very hypothetical question, which was, could international migration counter the trend toward population aging in countries of the more developed regions? And the reason that one might ask this question, we've mentioned many times that immigrant populations tend to be younger on average than the countries that receive them, and therefore immigration tends to lower the average age of the population. And to some degree, yes, it does counter the process of population aging. It slows it down, and it makes it a little bit easier to deal with the long-term process of population aging. However, the main conclusion of that report was that given plausible levels of international migration, migration could never reverse or eliminate the trend toward population aging. The main story was that countries could not count on international migration as a solution to population aging, and it was misinterpreted as an advocacy by the United Nations in favor of international migration. and that was never the intention. The point was to make to emphasize that population aging is an inevitable trend that comes with the demographic transition toward longer lives and smaller families. Inevitably, this leads to much older populations, and no plausible levels of international migration could reverse that trend for countries of the more developed regions. So I just wanted to clarify that. Thank you for the question.
Thank you.
Edie?
Thank you very much, Edith Lederer from the Associated Press. As someone who was at Cairo in 1994, I have a couple of questions for Ms. Kanem. At this Nairobi summit that's going to be held, is this still going to be in support of the 1994 Cairo Plan of Action, or are you going to be developing another one? What specifically is the focus going to be, and is it going to be accompanied by a major NGO conference as well alongside it? And for Ambassador Rattray, you said that this was so important because it was the first statement, declaration. You hadn't been able to get anything for 4 years. I gather from what you said afterwards that perhaps what made this political declaration possible was the fact that it is a one-page statement rather than perhaps something much more specific and more inclusive that you were trying to do previously that there was opposition to. Is that correct?
Thank you so much. Regarding the Nairobi summit, accelerating the promise of ICPD 25 years after Cairo, this flagship event will be held in Kenya, as mentioned, from 12 to 14 November, and co-convened by the government of the Republic of Kenya, and President Kenyatta will open the sessions, as well as the Kingdom of Denmark. The aim of the summit is very much indeed in line with the Cairo Program of Action from 25 years ago, but in the era of the Sustainable Development Goals, we are focusing on young people and inviting them to look at the next 25 years, to see how the SDGs and the rights and choices agenda for women and girls must coincide and accelerate, because indeed evidence shows that the fate of an adolescent girl is very much bound up, as I said earlier, with not only her and her family to come if she chooses to have children, but indeed her community, the investment in an adolescent girl that can pay at least 10 times more and even 200 times, according to Guttmacher in the Lancet Commission review on adolescence. So at this convening, we will bring together governments, young people who are helping even now to set the agenda, women's groups, the private sector, civil society, and community partners as a whole. In contrast to Cairo, which I also attended as a young philanthropy professional, the goal is not to adopt a new resolution and plan of action. It's to build on the one that we have already. It's to build on the decision, the laudable decision taken by the Commission on Population and Development today, which itself built on work done last year on the road to Nairobi, if you will. There were 5 regional discussions on sexual and reproductive health and rights under the banner of Cairo plus 24 last year, but looking towards today and the Nairobi summit. I will also say that much as Cairo was a watershed for women, and the goal, which was activated by all those women's groups and the civil society building on Rio in the prior 2 years and looking to Beijing, which followed the year after, our sights are to declare that rights and choices are at the heart of our threefold agenda, that family planning at the method and timing of a woman's choice is part of universal access for universal health coverage, that every preventable maternal death during pregnancy and childbirth is a tragedy and needs to be named as such. When Mahmoud Fatala addressed us in Cairo, he talked about the 5 planes that crashed that day. Well, today we're down to 2 plane crashes. 820 women die every day due to complications of pregnancy and childbirth. And for an adolescent girl, this is the leading cause of death among adolescent girls worldwide. In Nairobi, we will say that the world can do a lot better. So we're bringing the issues of financing for development, of looking at women and girls at the center of that SDG agenda as well, into Nairobi. And lastly, our theme of ending violence and harmful practices was elucidated beautifully today by Ashley Judd, who talked about being a survivor of rape here in the United States, where she would have been subject to a marry your rapist, in a sense, to acknowledge if she hadn't taken action. We see gender-based violence in places like Congo, Sudan, Syria. So, the list is so long, having visited the Rohingya camps twice myself already. So when we say an end to sexual and gender-based violence as the heart of development, this is one of the most common crimes against, period, 1 in 3 women. And in those violences, we do include child marriage and harmful practices. And that's why I was proud to say that since Cairo, let's take credit for that progress that we have been able to make, while still accepting that for a girl on the brink of adolescence today, what we do this year can set her up for success 25 years hence. That's our hope, our fervent hope. Thank you.
Thank you. Edie?
I just had a
we'll
quick
wrap it up.
follow-up. So is there going to be any kind of a negotiated document coming out of the Nairobi conference?
The conference will have a high-level governmental day on the 12th of November. There will be no resolution or negotiated document in Nairobi. Instead, we have relied on the Commission on Population and Development in their deliberations today to reaffirm the core of the Cairo principles. While, as our chairperson has remarked, a simple political declaration of a page or so must be construed as a success in the highly polarized environment in which we must tread to defend the rights of that adolescent girl, of that woman who is fleeing with the clothes on her back and expecting a dignity kit when she arrives in that refugee camp. We still say that rights and choices, being at the heart of the Cairo agenda, are important to build in to every facet of those 17 Sustainable Development Goals, and as mentioned, to transform our viewpoint to a life cycle view. A girl who is at the fork in the road today, when she is 60 and 70 and 80, if we look after her education, her health care, her desire not to be pregnant as a schoolgirl, she will be a successful older adult who can reinvest in the family and in the community. So this is why we have decided to have a summit which will be for commitments, financial commitments, political assertions by young people, by disabled people. So many are already gathering and planning for contributions that will be announced in Nairobi. Thank you.
Thank you very much, and thank you to the panelists. Thank you.